What I tell women, though, is don't have your orgasms with the toy, with the vibration and with all the things that a penis can't do. You know what I mean?
Wait, why do you say that?
I'm not afraid to write a brand new story. And when changes find their way to me, I can keep it moving. I'm not afraid to celebrate my glory. And when challenges grace my path, I know I can face another day. Inside, I rise, daring to learn. With Fox After 40.
What's up, you guys? Welcome to Fox After 40, where we discuss all things women's wellness from head to toe. And today, you guys, we have one of my favorites here with us on the couch, Dr. Mia, who's a board-certified gynecologist and expert in hormone therapy and intimacy. So today, we're diving deep into the topics about sex and how your body changes after 40. But before we do that, I would love for Dr. Mia to introduce herself and tell us more about you.
Yes, and thank you for having me and allowing me this opportunity, Kim. So I am Dr. Mia, B3 specialist and board-certified gynecologist, and I help men and women suffering with weight gain, fatigue, and sexual dissatisfaction improve their quality of life through my cutting-edge services, which include all total wellness services.
Okay, Dr. Mia, can you tell us a bit about your background? I know you were titled Top 40 Under 40 for the Birmingham Business Journal, and you have a ton of awards, Emerging Business of the Year, so many. But can you give us your background, how you got here? And I know there are lots of different fields you could focus on within gynecology. Mm-hmm. How did you land on hormone therapy and intimacy?
Okay, great question. So first of all, I started my practice in 2010. So I left working for the county hospital on purpose. So when I finished my residency, I started at the county, and I realized I don't work well for people. So I couldn't do the politics. So I went and got my MBA. And during that time, I basically built Me Bella Wellness Center. And I knew that I was going to offer weight management was actually my initial focus because my background is also health education and promotion, so focus on prevention and screening. And so I knew I was going to do the weight management component, and I thought I was going to keep my job while I had my weight management clinic. But again, I can't play the politics well, so I ended up without a job with my weight management clinic, and so I added the gynecology to that. So I continued to do just gynecology. I stopped delivering babies, focused on gynecology for women. So that kind of brought my population to be like women in their late 30s, 40s, 50s, 60s, because the women who were having babies were still seeing an obstetrician. So once I got that population, I started to notice some of the same problems, the same pain points, fatigue, sexual dissatisfaction, hormone imbalance, and all the things that I was taught as a resident didn't work for that patient population. So that kind of put me on the path to explore and see what I could do to help my patients. So I delved into hormone pellet therapy, hormone creams initially, just plant-based bioidentical, because I always believed in a natural and holistic approach to medicine as well as traditional. And so that kind of took me down the path of hormone pellet therapy. Then I started getting my women feeling better. They were having great sex again. They were happy in great relationships. And then they started to notice that their intimacy was still not where they wanted it as they aged, and that's what got me into the intimacy services. So I was fixing all the women, so their men were at home not getting fixed. So that's what got me into men and women, and it all really started with weight management and a focus on total wellness and living a life of total wellness so that you can age well.
And I wanted you to mention this. You said you were the first chief resident. Can you explain it for me?
So in my residency program, I was the first Black female chief resident of the OBGYN program at the Medical College of Wisconsin in Milwaukee, Wisconsin.
Kudos. I love that. And you said you mentioned that moving from your weight clinic to the hormone therapy, you noticed that the things you were recommending to the women weren't working. What were you recommending that was working for your 20-something, 30-something-year-old patients, maybe 40-something, but wasn't working for your 50, 60, 70-year-old patients?
So I think a big component of it was menopause. Like, we weren't really trained on perimenopause and menopause. We were taught against hormone therapy because of this big study in 2000. So those were synthetic hormones. So it scared everybody away from it. So what happened is they put all these women off hormones that had been on them forever, and they were miserable. They were having hot flashes and night sweats and, vaginal dryness, no libido. And so what they taught me to use just was not working. So that's what made me kind of start to research and figure out that it's plant-based bioidentical hormone therapy. I started with creams. I was actually at a conference and this older gentleman walked up to me. He was like, oh, you're practicing gynecology? Are you offering hormone pellet therapy to your women? And I was like, no. And he was like, well, you're doing them a disservice. You need to research it and you need to figure out how to offer that to your women because it will change their lives. And that's what got me into the hormones.
Can you mentioned perimenopause and then menopause. Can you talk about the phases of menopause, where they start, where it ends, the time period in between, just so that our listeners can because when you told me this, I was fascinated because I feel like you told me it could start as early as your 30s or something like that. So can you talk about that, please?
So when I talk about perimenopause, I'm really focusing more on testosterone. So nobody thinks of testosterone because I call it the forgotten female hormone because men have so much more. And then I call it the anti-aging hormone. So once you hit your mid-30s, and sometimes if you're on hormonal birth control, that suppresses your testosterone even further. And that's when women will start to notice that they're waking up in the middle of the night again. They're having night sweats.
What are some hormonal birth controls?
So Mirena IUDs, birth control pills, the birth control patch, anything with hormones in it, the Depo shot, the NuvaRing, all of those are hormonal, all of those.
And those speed up perimenopausal, the phase. They speed up menopause.
Because they decrease the testosterone levels even further than just aging, which makes people experience a lot of those symptoms much earlier.
That's why. So when I got on Implanon in college, I gained so much weight, like 40, 50 pounds. I had lost like 40, 50, in freshman year, gained it all back in like my senior year when I got on Implanon. And then I did not know that birth control speeds up menopause. Oh my gosh.
Well, I won't say speed up menopause. I would say it suppresses the testosterone where you can experience the symptoms even at an earlier age because of the suppression of testosterone. Oh, wow. Because testosterone, when you have enough of it, you feel great, you have a great libido, you have great orgasms, you sleep well, your energy's good, you can focus. But as it starts to decline, slowly and surely those symptoms start to arise. And they're so gradual that sometimes people just look at it like, this is just normal life. As I get older, I may not sleep through the night, or I may have night sweats, or my libido goes down because, my grandparents slept in different beds, you know what I mean? And they take it as just normal, but really it's just the testosterone thing. So replacing the testosterone fixes all that, and you don't have the perimenopausal symptoms. And when I say menopausal symptoms, those are the women who are closer to 50 or who've had their ovaries removed and they no longer produce estrogen. So testosterone to me is more like perimenopause. Once you stop having estrogen, that's when women will start having the hot flashes during the day, more vaginal dryness, the facial hair, the acne, the thinning of the hair on the head, the change in the eyebrows and eyelashes. And it still affects mood a little bit, but those women have usually stopped cycles for at least a year and their ovaries are no longer producing testosterone or estrogen.
If you've enjoyed this episode of Fox After 40 and want to get notified about the next episode when it drops, make sure to go to CurlMix.com and sign up for our mailing list. We'll notify you whenever a new episode comes out. Now, when you say vaginal dryness, when does that start?
It can start anytime.
Okay.
Because hormonal birth control suppresses the estrogen in the vaginal tissue. So for my women, if they're on birth control, I have them to use an over-the-counter product that they can order online to treat the vaginal tissue, to keep it lubricated and sensitive and orgasmic. And then as they continue to age, like when they hit 40, I usually have them to treat it with the hyaluronic acid and a vaginal estrogen that is a prescription that your doctor would write for you. And not only does that help with vaginal dryness and sexual function, but it also decreases the chance of incontinence, like leakage of urine with coughing, sneezing, jumping, laughing, and urinary tract infections.
So the issue is a lack of testosterone.
Yes, to start with perimenopause.
Before we go straight to hormonal therapy or things that we have to add, is there anything you can be doing in your day-to-day to get more testosterone to help with perimenopause or menopausal symptoms, any of that?
Great question. So for one, you can do non-hormonal birth control. So like doing a Paragard IUD and even doing the Mirena IUDs, they don't suppress it quite as much. But if you don't want to suppress it at all, doing non-hormonal birth control or contraception.
Not the pull-out method though?
Not. You can try it.
Okay.
And so then as you age, exercise actually helps. So holding on the muscle actually helps. And so a lot of my women who come in and they're smaller and they're active, they may not have as much of a suppression of their testosterone, but they tend to actually need more testosterone. But living a healthy diet, but it's a part of the aging process. So it's almost nothing you can do to stop testosterone from declining besides replace it.
And so, but you can lift weights, right?
You can lift weights and that will help.
Okay. And then I imagine maybe like a heavy protein diet?
A healthier diet, yes,
Yeah,
and with plenty of protein, definitely.
Okay, cool. So the testosterone's an issue. At what point where you're like, okay, I don't care how much you weight lifting, I don't care how much protein you're eating, you're gonna need to supplement this with some actual hormonal therapy.
Yes.
What is happening then where you're like, okay, I have to, those women are like, what are they going through that they say, hey, I need to make a change and actually take a supplement right now?
So now the symptoms are really affecting their quality of life. So now they're having night sweats every night. So they're waking up with a wet bed, it's interrupting their sleep, or they think they have to go to the bathroom often because they're not sleeping well. So they're waking up in the middle of the night. It's hard to fall asleep. A lot of women definitely notice the decrease in libido. So it's not that they don't want to be with their partner, they love them any less, they just don't have any testosterone, so they don't have that sex drive. And then the decrease in orgasm, so having to work harder just to have an orgasm. The fatigue, and it's not like I'm tired. It's like waking up tired, being tired in the middle of the day. It's like a severe fatigue. Weight gain, especially in the belly, is a sign of low testosterone. Joint pain. And then everybody thinks they develop this adult ADD. A lot of times that's low testosterone. So you get mind fog. You walk in the room. You can't remember why you walked in the room. You can't remember names and words. And then the one that really affects women a lot and men is the mood changes. So if you already have like bipolar disorder or depression and anxiety, it tends to worsen significantly. And the testosterone helps with mood. And a lot of women will notice irritability. Like you see things that have been going on forever, but they bother you so much more and you can't help but respond to them no matter how hard you try. And so nobody likes you anymore because you say everything that's on your mind. So those are the signs and symptoms that your testosterone's declining. And at the point where it's affecting your quality of life, it's time to do something about it.
So meaning if you start losing friends, or you might be considering a divorce.
Or you're just miserable. And you're just like, I don't want to age like this. Like you can prevent it, you know? Because actually when I first started doing the pellets myself, I only got my blood drawn because I was going to training. And they were like, you know what? Just get your blood drawn, bring it, and if you need pellets, we'll give them to you. I was 38 then. So I thought that all this stuff was normal. And I was also starting a practice, so I had that stress, you know what I mean? So when I got mine drawn, it was like 10. And so we say if it's less than 70 and you have severe symptoms, replacing the testosterone helps. So when I got the pellet, that's when I felt great and realized.
Wait, you said yours was 10?
Mine was 10.
And it's supposed to be 70?
Well, yeah, they don't really have a real range, but we say if it's under 70 and you have significant symptoms, replacing the testosterone will improve those symptoms.
And so just from my brain, I'm so curious, how much does it replace? Like if you're supposed to, let's say you have 100% hormones, maybe 50 estrogen, 50 testosterone. I don't know how the math works. And your testosterone is dropping down to like 10 and you need to, is it replacing the 40? Like what's the math around that? Is that, and maybe I'm just
That's a good
focused.
question. No,
okay.
That's a very good question. So when I replace mine, I need mine at 400.
Okay.
When I replace the average woman, between 200 and 400 when they're on hormone pellets is a good number for most people. But that's why I like the pellets, because it's individualized.
And 400 what?
That's the unit. I don't remember the unit, but
Gotcha.
that's the number for total testosterone. So
okay.
it'll start at like 10 and I'll replace mine up to 350 to 400. The average woman feels great between 250 and 350. And men, it's more like 1300.
Gotcha.
You know what I mean? So men.
Oh wait,
and
1300?
Yeah, so they have like 10 times more than us. So whereas I may get 250, Joseph probably gets 3,000.
And Joseph is your husband?
My husband, yeah. Or a man gets 3,000.
Wow. Okay, so then how much estrogen do we have?
Well, right now, we should still have estrogen because you're not in menopause. Once you hit menopause, it's just nothing. So it just
When you
drops
say
to,
nothing, what do you,
like,
so was it
on the
1500
lab,
before?
it's going to say, so but before, it'll vary depending on where you are in your cycle. So for a premenopausal woman, it doesn't mean as much as for a postmenopausal woman. So when I'm looking at the labs, I look at like the FSH. When that's starting to increase, I know you're going through menopause. But once I see that there's less than 15 of estrogen, I know you're in menopause chemically, and you're not going to produce it anymore. And I can see that in the estrogen level as well as the other level, the FSH, which goes significantly up while the estrogen goes down.
And so my assumption is that women who get pregnant, after 40 or, and I've had some customers on our Facebook group, they've been, they've gotten pregnant. I'm assuming that they have their hormones are balanced and that they're not having these issues until much later. Is that true?
Not necessarily, because I've actually gotten some of my patients have gotten pregnant. Like they wanted to have children, they were feeling miserable. I put them on the pellets and they get pregnant on the pellets. You know what I mean? So I
Okay.
do think that testosterone has a lot to do with some of the fertility things, because when you're younger, you have more testosterone. It's easier to get pregnant. As you get older, your testosterone declines slowly but surely, and it's harder to get pregnant as you're older.
But then they get on these hormone replacement therapy pellets, and then they get pregnant.
Some of them have.
Oh, my
I'm not
goodness.
saying that always happens, but so that's what I'm saying. So it's definitely a hormonal thing.
Okay, that's good to know.
Mm-hmm.
So, what do your clients come to you with the issues that they may be experiencing, how they might be feeling, or things that are going on in their marriage, and they say, "Help me, doc," and then you help them. What does their life look like after they get in this hormonal therapy, or and is there more than that? Is there more than the pellets? Is there some other kind of treatments that you end up doing as well?
Okay. So when somebody's really young and they don't have a lot of symptoms and their testosterone isn't significantly low and is not negatively affecting their quality of life, I do have one supplement in my supplement line called T-Support.
Okay.
And that is made from a tree in Asia, and it naturally increases testosterone levels. So somebody with really mild symptoms or somebody who doesn't want to experience those symptoms ever, that's a good supplement to start with.
Does that grow your hair?
Does testosterone grow your hair?
Yeah, like more of it, or not really? Like,
Not necessarily. Now, too much can thin the hair.
oh,
But if I balance it out and you're starting to notice hair thinning, women will notice that their hair gets back to its normal place before the testosterone decline.
okay. So the T supplement is for the younger, your younger patients, and then so after women go through this hormonal therapy, what do they report back to you, saying how they feel or what's changed about their lives now?
So now they're sleeping. They're having great sex with their husbands. They like their husbands or partners or whoever again. Their energy is better. So they do better professionally. They're better with their children. They're more patient with their children. Their mood is better. Some of them can come off of some of their anxiety medications, their sleep medications. It definitely helps with weight management because it helps you to hold on to muscle. So if you're exercising, it increases the metabolism and you're eating enough protein. And so that makes it easier to lose the weight and keep the weight off. And it also keeps you from gaining as much belly fat. So women feel better, they have more energy, so they exercise, and then they're having great sex, so they have better relationships, and their mood is better.
What's the time frame? So I know from perimenopause to menopause to getting out of it, how long does that take and what's the range?
So we say perimenopause can last up to 10 years.
Oh, wow. I could be perimenopausal right now.
Right. You
Okay.
could be.
Okay.
But you would know because you would have the symptoms and you would have said fix it.
Okay,
You
gotcha,
fix
gotcha.
it. But so it can last up to 10 years. And then, of course, if women have surgery and they get their ovaries taken out, they go into an immediate surgical menopause, which is way harder than a natural menopause because it's just like somebody yanks all your hormones off and overnight you don't have any hormones versus the gradual progression into perimenopause and menopause.
And removing your ovaries versus hysterectomy, is there like a difference in the hormonal, yanking, or is it very similar? It doesn't really matter.
It does matter.
Okay.
So a lot of women are having to have hysterectomies. They didn't have fibroids, or it's a good reason for them to have a hysterectomy. We say that if you're under 60, you should leave the ovaries if they're normal and they don't have an increased risk of like breast cancer or ovarian cancer, meaning they don't have a gene or anything that's saying they're going to get breast cancer or ovarian cancer. And that's a very important point because it increases the risk of death from heart disease. So as soon as your hormones start to decline, if you think about it, women have heart attacks after menopause when they're in their 50s. If they go into menopause early, they tend to have heart attacks earlier.
Oh, I didn't know that.
Yeah, so the hormones not only help you to feel good, but they protect your heart, they protect your bones. So women start to lose bone when their hormones start to decline. It decreases the risk of dementia, and testosterone hormone pellet therapy actually protects the breast, which is huge, and decreases the risk of breast cancer.
Wow. Where am I supposed to go to learn this if I wasn't just sitting here talking to you?
You got to follow Dr. Mia, and because it's not like a traditional, it's not traditional medicine. So I trained in Milwaukee, Wisconsin. So it was very common to use holistic treatment options. A lot of people did, kind of alternative medicine. When I came back to Alabama, a very closed-minded state, a lot of people weren't doing anything. Like a lot of the doctors there say, get off your supplements. They don't believe in hormones.
What?
And nobody cares about the sexual health for women. So it's never been studied. So that's why we don't even know what a good range is for testosterone, because nobody has ever cared that women have good sex. We are taught as women, and I've had patients to come to me, they tell their doctors, their male doctors, sometimes their female doctors, my libido is low and I'm not enjoying it as much. And they tell them, it's just a part of age, and just lay there and act like you enjoy it. Like they actually tell these women that.
Oh my gosh.
So it's just not been something that's studied, but now women are in medicine, and I'm going through all these things, and I plan to have great sex until I die, and I plan to age in such a way, so I'm going to figure out all the things I need to do to age well, and a big component of that is hormone balance.
Shout out to Dr. Mia. You're doing the Lord's work. If you've gotten any value from listening to Fox After 40, you learned a beauty tip, you've gotten advice, you shared the episode with a friend, please do us a favor and leave us a review on Spotify and Apple. It goes a very long way in helping us continue to build the podcast. Okay. And you're so right. People don't care about women's sex habits
or
and life
menopausal
afterwards.
symptoms, or whether they're comfortable, whether they're happy. Now, men, it's all kinds of stuff for men and their sexual function. It always has been.
Man, that's why there's 30 Viagra for men and like 1 for women.
Exactly.
1 for women. Shout out to Cindy Eckert. Okay. Yeah. From the Pink Pill. So when does it end? Because it sound bad, okay?
Right.
It sound real rough, but it does sound like there's some reprieve. There's a treatment that you can go through that would fix it, which is, I'm happy to hear. When do you get out of this menopause state? So starting in your 30s, it's happening in your 40s, is
for real in your 50s.
For real in your 50s. When is it over?
It's over. After your 50s and you stop producing estrogen and testosterone, the only way to get it back is to replace it. Now, for some women, they don't have severe symptoms. So every woman does not have severe hot flashes and feel miserable and need hormone pellet therapy or hormone therapy in general, but some do.
Oh, my goodness. I know there's beauty in aging because that's the whole point, right? You want to live longer. I do want to enjoy it, but these conversations were scary for me when I heard you guys talking about it. So the reason I was inspired to do this podcast was really a conversation I had with Dr. Mia and some of our other friends. I love to sit around and ask married women about their lives. Like, what is it like for the last 20, 30 years? What is sex like? What is, dating like? What is parenting like? And I remember you guys just kind of doing a round table about hormones and sex with their husbands. And what else were y'all telling me about? Vaginal dryness. Y'all told me y'all had a friend who couldn't walk to the car without crying because her vagina was so dry. And I was like, wait, what? And you're like, yeah, it's just menopause. And I was like, I had never heard of this stuff. Why isn't someone telling us this? Why isn't there a place where we can go to get educated on this? I feel like I should learn this in college.
Right. And you should learn it from your doctor. And the doctor that you're going to, if you have a gynecologist and you're in perimenopause, they should be asking you about your sexual function. They should be asking you about vaginal dryness.
And I feel like this is great. And I can totally ask my Dr. Cordy Clark White. She's dope in Chicago. I could totally ask her. But the thing is, I wouldn't even know to ask her. You know what I mean?
That's
Unless
right.
there's a problem.
Exactly.
So it's like, but someone should be telling you, hey, you should be lifting weights earlier, younger. Hey, you should be having an increased protein diet so that you can maintain your testosterone. Hey, you should try to avoid hormonal therapy for birth control because it has all these later effects. No one's like giving us that information, and that makes me angry a bit.
It's frustrating. And I won't say you shouldn't do hormonal birth control. You should just make sure you replace your testosterone. Because I've been doing the NuvaRing, and I'm going to do it until I know for sure I'm in menopause, so I know I won't get pregnant. So you can still do your hormonal therapy. You just may need testosterone earlier or a little bit more of it.
Is there any birth control that you don't like?
No.
Okay.
No, I don't prefer progesterone only for my older women. When you're talking about the Depo shot or the Nexplanon, because they tend to gain weight much easier on it. So I prefer like the Mirena IUD if you're going to do progesterone only. But I think birth control pills, NuvaRing, patches, all of those things work well.
So do you do anything beyond hormonal therapy? Like, yes. What else do you teach your patients about when it comes to intimacy?
So we do the O shot at Me Bella, and we do the P shot. So not only do I take care of women, I take care of men. So we do the hormone pellet therapy for women.
Wait, what's the O shot?
The O shot, that's what we're getting to. So the O shot is where we take your platelet-rich plasma. So we draw your blood, we spin your blood, and then we take all the good stuff off of it. And we can also add, like, some people call it a stem cell, but we don't say that, but it's hyalogel. We can add that to that concentrated blood, and we replace it into the G-spot for stronger, more intense, more frequent orgasms, and to the clitoris for longer, more intense, and stronger and more frequent orgasms. And it helps with tightening of the vagina. It helps with leakage of urine, with coughing, sneezing, jumping, laughing. It helps with sensitivity, lubrication, and both partners notice it. So, I get my O shot every year. Joseph gets his P shot every year, and we'll be 85 years old.
Now, am I too, like, what age did you start getting this O shot?
Whenever you notice a difference. So some women, after having, if they push 2 babies out, they may notice that they have more laxity and they have to use lubricant. Or they're leaking urine with coughing, sneezing, jumping, laughing. Okay. Because that was my initial thing. I had an 8-pound, 8-ounce baby. So just coughing, you leak a little urine. Nobody wants to do that. So that's what that's not the whole reason, but that has helped significantly with incontinence or leakage of urine.
But why would that help with urinating?
Because
that seems
it
like
goes
it's a vaginal
at the G
thing.
spot and it's regenerating tissue under the urethra, and the urethra tissue is what weakens. The vaginal tissue is what weakens, which is why I tell my patients to start treating the vaginal tissue before it weakens, kind of like we do our face. I'm like, you got to treat your vagina like your face. We do hyaluronic acid. We do all of these things for our face. You have to do those same preventive things for the vaginal tissue.
So can I start before I notice that there's a problem?
Yeah.
So, okay, with the
shot?
Nobody's
ever told me they had too many orgasms or that they were too intense. Like, I've never had a patient to say they were too lubricated, too many orgasms, or their orgasms were too intense.
What's the retention rate on the O shot? They get it once. How often?
They keep getting it.
100%.
Yeah, I don't say 100% because it's a cost thing too.
Gotcha.
These things aren't covered by insurance, so hormone pellet therapy, but the value of it and just investing in your health is worth it for most people.
Good sex is priceless.
Yes.
So what's the cost range for an O shot and a P shot? So, and we have to figure out what the P shot is too.
Okay, so the cost range for the O shot and P shot anywhere from $1,250 to $1,750, depending on where you go.
Okay,
and then if you want to add that hyalogel for an even better result, that's usually about $850 to $1,000 more. And for men, it's really the same process. We get the blood, we spin it, and we replace it into the actual penis. We numb, we do a topical numbing, we do a penile block and a clitoral block. So everybody's comfortable as they can be with, injecting in that area. But that's going to help men with erectile satisfaction. So men, as they age, they notice that their erections aren't as firm. They can't always get them on demand, that they can't finish. And they have a decrease in sensitivity too. So the P shot for men helps with all of that. So the combination for a couple just makes for amazing, healthy intimacy.
Okay. In the procedure, is this like I'm just coming into your clinic and, we just pull a curtain back, bop, bop, bop? Or is this like I got to check into a hospital? And
No, it's in my office. So you come into the office. We do what we call an O wave first, which is sound wave energy, because really the change in sexual function has a lot to do with blood flow. Okay. So as you age, you have blood flow and it's going to decrease to the vagina and the penis first.
Yeah.
So you come in, we do an O wave, which takes about 10 minutes. We sit you under the red light to increase the blood flow, and we put a topical numbing on. Okay. And that stays on for about 20 minutes. Then I come in and do a clitoral or penile block. Let that sit for about 10 or 15 minutes, and I just come back. They would have drawn your blood, and I put the blood back in, which takes me about 3 minutes to actually.
Oh, so this is a quick procedure too.
Very quick, and you don't have any downtime. You can immediately go and have intercourse that same day, but you probably don't want to because you're still numb, so it would be kind of not a good point for you.
But like hold up a little bit.
Yeah. So the next day you're definitely like ready to go, and you probably notice the improvement in anywhere from 2 weeks to 2 months.
This is so good, Dr. Mia. Okay, and I have one last question. Are there any like long-term effects of using toys? For women, men, anything that you've seen, any advice you would give? No, and I think as you age and mature, sometimes it may become a part of your relationship. If things aren't working well, you're not getting your P shots and your O shots. But it's nothing wrong with toys. What I tell women, though, is don't have your orgasms with the toy, with the vibration and with all the things that a penis can't do. You know what I mean? Wait, why do you say that? Because it'll make it harder for you to have orgasms with your partner. If you get used to kind of like watching porn all the time, you know what I mean? You get used to seeing all this like magnificent, crazy stuff that nobody does. And then you try to, you know what I mean? You're that's not how it works. So I always say if you use toys or when you use toys, get to the point, but try to have your orgasm without the actual vibration and without all the extra stuff. Gotcha. Be gentle. Get to the point, but don't climax with it. Gotcha. Okay, wow. Is there anything that you want to leave the people with, Dr. Mia? The women who are listening, thank you, and I'm sure they're thanking you right now because some people are going through these issues and they don't have a resource, and so thank you so much for sharing all your information. Is there any message you want to leave people with, or anything that we didn't discuss? I would say that now I say all of these things, and we have all of these wonderful services. We have hormone pellet therapy to make menopause better. We have the intimacy procedures, but the total wellness component is just as important. So prevention, screening, going to your doctor, keeping your blood pressure together, keeping your blood sugars low, keeping your cholesterol low, keeping a healthy heart. All of those things are important
important for intimacy. And women who have regular intimacy live 5 years longer than women who don't. So it's important. Women who have regular intimacy live 5 years longer than women who don't. And you don't have to have a partner to have intimacy. You can still have orgasms without a partner because we serve a good God who gave us a clitoris and gave men what they need. So you can still enjoy your personal intimacy even if you don't have a partner.
I love
so you can have great sex, you can age well, you don't have to go through menopause and be miserable. There are so many services out there to help you get through and be healthy and well. So that's why we teach women and men to live well, age well, and experience everlasting intimacy at Me Bella.
I love you, Dr. Mia. I will give you a standing ovation. This is like an amazing episode. Thank you so much for coming on Fox After 40. This is going to mean so much to our listeners.
Thank you for having me.
Oh, it's my pleasure. All right, you guys. Thank you for tuning in, and I'll see you on the next episode of Fox After 40. Don't forget to like, comment, and subscribe for more.